So thank you guys for allowing me to do the project here. I really appreciate all your help. I know we've kept it kind of minimal, but I think it's kind of interesting to do a stress assessment at the healthcare facility, especially where I'm working. So we'll get started here. So just a few disclosures to begin with. The project was completed in partial fulfillment with the University of Wisconsin-Stevens Point Master in Health and Wellness Management Program. All the information that is used in the presentation will be used for educational purposes only and will not be shared without appropriate consent from you guys. So first, we're going to start with our organization background. As you guys know, we are a healthcare facility. I wanted the project to be about everybody within the facility rather than just one group within it. So there are a variety of employees with different job descriptions, different tasks and needs that are required from them, from the doctors to the front staff to the transcription. But you guys obviously kind of running the whole show here. So there's kind of a whole broad spectrum. So that's kind of the background on that. The primary mission of the organization is to provide excellent patient care. Everybody's goal is to kind of help assist towards that and keep things flowing so we can give the best care that we possibly can to every patient that comes through. We'll go through current available programs. Just recently was the employee support services done through occupational chaplains. They basically give work, personal, and life support 24/7 if anybody needs anything, not just related to work, but also within their personal lives as well. They get that support from the organization that's given through that, which is an awesome program to start with. Like I mentioned, the target audience of the research project was the whole entire organization, so we sent it out to everybody to participate rather than just one occupation, such as the doctors within it. So kind of give us a broad spectrum, and also gives a lot of backgrounds coming into it as well. Next is the background literature on stress, just so you guys can learn a little bit more of how stress impacts everybody. Obviously, everybody knows it's not a good thing. It can be at times, but when it's poorly perceived, it can be pretty detrimental. I have a long list that I'm going to list off here for you guys for health impacts. It's kind of shocking to hear everything that can be just related to having stress within your employees. So depression, anxiety, heart disease, cancer, diabetes, fatigue, obesity, body pain, impaired memory, impaired ability to learn, burnout, low quality of life, severe distress, increased risk of suicide, and also increased risk of substance abuse. So those are many, but not all, of the health impacts that come just from having stressed employees. There's also organizational impacts. So not only does it affect employees' health, but it also affects the health of the organization and how well it runs. There's also a long list for this too, so bear with me again. So there are increased rates of absenteeism, so people not showing up to work, people calling in sick because they're stressed and it's affecting them. Increased rates of turnover, so we're hiring new employees and having to train new ones in more often than we probably like. Increased rates of workers' compensation claims, so it's costing the organization to begin with, just at the straight money paying for people being injured and ill as well. There's also high rates of low morale, reduced productivity, increased medical costs. So overall, it's costing the organization in the way it has productivity, but also physical money too, from having sick employees and not having people show up and having that turnover as well. As we've mentioned many times, this is a healthcare facility, so we also want to touch on stress within healthcare. Everybody that works within the facility has special stressors from having patients come in that are injured or ill. So we have to kind of touch on that as well. Not only do the healthcare providers feel stressed from having to provide care, but also the patients are affected from their providers being stressed as well. There have been studies shown that they're unable to provide proper patient care when they're stressed. There is a reduction in patient satisfaction and compliance. There are diagnosis and treatment errors, and there's also lower patient safety when the staff around them are stressed. So now, obviously, we want to be able to do stress management techniques. So we'll go into some theoretical foundations that deal with stress theories. Stress is a all-encompassing kind of thing, so there are multiple different theories that can kind of go into it for a stress management program. The first one is the trans-theoretical model. It's otherwise known as the stages of change. So there's different stages getting up to actual behavior change. So this model basically goes off of that. There are primary, secondary, and tertiary levels of intervention, depending on what level you want to start getting into things for making people to get those changed. And there's been found to be effective with complex health things such as stress to tackle that issue as well. And the study that I was reading about, the practicing stress management, once they got people to, it was successful in getting people to start practicing stress management, and it was also effective at keeping them practicing stress management as well. So it effectively got people to change their lifestyles to do that stress management as well. The next one is cognitive action theory of stress, and I'll refer to it as CATS, so I don't have to keep repeating that over and over again. It mainly deals with stress stimuli, so how the person perceives stress, and how it can be different between people. This has to do with what is actually happening to them. So two people can have a same situation happen to them and perceive it as stressful or not stressful, or a good stress versus a bad stress. But also it can be on a person day to day. They can perceive stress as different depending on their resources that they have. So if they've already got a lot going on and something stressful happens, then they're going to perceive that as more stressful than they might not on another day where they have more resources available to them. It has stimulus expectancies. Like I mentioned, something happens, so they have something built up in their head and how they're going to react. And also outcome expectancies. They have a built response to a certain thing that occurs, so they're going to react based on how they have had in the past, and that's how they're going to react no matter what happens as well. There are 4 steps within the stress process when it comes to CATS. There's the stress stimulus, so whatever happens, the stress experience, how they feel it within themselves, general response, and how most people are going to react to that certain situation, and then that person's personal experience and how they are perceiving it depending on their resources and the stimulus that is given. The next theoretical foundation is the stressor detachment model. It uses the CATS that we were just talking about and also the allostatic load model. That is basically how the people are getting the load over time with repetitive chronic stress. So it goes on how people are perceiving the stress and also how that stress goes if they can't escape from it. So as the name says, stressor detachment, we want to be able to have them detach from their workplace stress when they're not at work, so they can actually not take that home with them and go in a constant work cycle. So next is just the scope of work and the driving question for the research project. Basically what it is what areas of stress impact the organization the most and who is being impacted by that. So are there certain people who are being impacted more than others, and then what are the areas that are seeming to give issues? For the implementation of the program, we had participants. Like I said, we invited 66 employees to participate within the research survey. The survey was Health and Safety Executive Standards Indicator Tool. This tool has 35 questions, and it uses a 5-point Likert scale. So 1 is a poor outcome, 5 is a good outcome. There is 6 different areas within the tool. The people who are taking it don't get to see them, but when you're grading it, you get those 7 different subsections as well, where you can kind of see what areas are lacking or what ones are performing well within the organization. Those subsections are demands, control, manager support, peer support, relationships, role, and change. And we dispersed the survey through online and written format to kind of accommodate as many people as we could. So they were able to do that voluntarily, and there was no, it was all anonymous as well, so they felt comfortable taking the survey. There were additional measures for demographic information, so we could kind of break down, see which subgroups were having issues comparatively to each other as well, which we'll go over in the next few sections here. Those measures included sex, age, time in their current position, job area such as clinical or office staff, employee classifications, hourly versus salary as well. So now we'll kind of go through this, the results that we found. So it's kind of the exciting part here. So we had 25 participants. That's a 38% response rate. And 18 of them were female, 6 were male, and 1 left it unanswered. There were 13 office staff, 1 clinical staff, and 1 preferred not to answer. And there was also 16 hourly staff and 9 salaried that responded. Then we're going to go through some general strengths of the program, some general weaknesses, and also differences between groups. So the next part we're going to look at is the strengths overall and the weaknesses overall of the whole entire population. See which ones are lying up more at the 5, ones are lying down lower on the scale. And then after that we'll go over, we're not going to go on the scale 1 to 5, but compare and see if the one has a much higher score than the other with the different groups to see which ones are having those struggles overall. So first we'll go over this. We'll go over the green ones. We have that kind of box section there that's doing really well. We have the one with relationships, 4.49, pretty high on the scale. People within the organization know their role really well, and they don't perceive stress to not knowing what their role is, and that kind of confuses them and puts stress on their lives. Also 3.81 for both peer support and relationships. So overall in the organization, that's a strong area that people are feeling. So they're being supported with their peers, feel like they have good relationships with their fellow employees as well. Some areas that were lower on the scale was definitely change with a 2.81. So people are having stress when it comes to change within the organization. They don't feel maybe included, or otherwise they're just having a stress response to the change within the organization. Another number that's a little bit lower is the manager support. So we want to kind of go into why that's also happening for that too. So that's the general results. We'll kind of go over office versus clinical first now. And like I said, we're just comparing the office versus the clinical staff. Not the number overall, but to see if there's a large difference in some of these. So we kind of looked at this here, the manager support. So clinical employees feel like they have decent manager support, but you can compare that to their office counterparts. It's quite a bit of a difference there. So there's something going on where the office employees aren't feeling as much manager support, as well as relationships. So there's an issue with the relationships in the office employees as well. So you look here, the clinical employees, going on that 5-point scale, 4.23, that's pretty good. They've got good relationships. And then we jump down to a 3.42, not terrible overall, but comparatively there's an issue going on with the office staff mainly. So like I said, who's being impacted? That'd be a group there that is having issues with relationships. And then the next one I did hourly versus salary. I know some of those employees kind of overlap with the office versus clinical. I just wanted to see if there's any more additional things that popped out. There was one mainly. There was a bigger difference in the manager support. So hourly employees are feeling much more like they're not having stress related to that. And then relationships, again, that's another issue there. Still a strong number for that. But then also change. There's a little bit of a difference there. So salaried employees are not having stress response to the changes in the organization comparatively to their hourly employees as well. So like I said, there's some good ones to see that we can kind of target and see who's actually experiencing those issues. The last one here is the female versus male employees. As I mentioned in the beginning, we only had 6 males respond. Obviously, we want a little bit more than that, but we still want to evaluate, see if there's different areas. And what popped out is actually that males are having stress response to the demand that they're under. So this is kind of the one that, first off, the males are having issues with it compared to the females. They're having less issues with the demand of their job. And then if you look at the relationships, the males are having pretty strong 4.29 compared to their female counterparts. So they're having also issues with the relationships in the office. So if we would jump back, that was one of the strengths within the office. But if you look back comparatively, there's some issues compared to each group that are sticking out overall. So we'll go through some of that applications of the results that we just went through. So as I mentioned, overall issues with managed support and control. So that might be a broad stress management program that we want to tackle, figure out what's going on, but also those specific demographic groups, and we'll kind of go over that too. I'll just kind of remind everybody. So manager support, there was issues with overall, but also the hourly and office employees. So that might be a little bit stronger one that we kind of tackle into there. If you guys wanted to do a stress management program for the manager support, we can do one general overall and then really kind of dive into why those people are having it. The relationships are the hourly, female, and office employees. So we want to make sure people are feeling supported in their relationships at work, kind of trying to figure out what's going on with that so they're not having stress when it comes to relationships and their fellow employees at work. Change was the hourly employees mainly, and then also the overall. There was a big issue. That was the lowest one on the scale. So maybe when change gets implemented within the organization, they're just trying to do different ideas to make sure that's not as stressful for people. And then demand was the male one. So the males within the office, the ones that we got responses from, are perceiving that less than their female counterparts. But there are also additional research needs to be done. Like I said, we had a 38% response rate, 25 are responding. We'd like to up that number so we get a better picture on seeing what was going on. And responses is great, getting a good starting point, but for each future research, that would be much more beneficial to get more responses. And also, as we mentioned, those different groups, like his relationships management, why is that going on? We need to further research so we know how to tackle that a little bit better. So yes, you're perceiving it as stressful, but what's going on within that and how can we change that to actually have that stress management program to actually make good change for it. So that needs to be done as well. This just gave us a good starting point to seeing what areas are having weaknesses and what areas are having strengths as well. So the limitations as well, going on not a high response rate, we'd like more employees. The survey is only one survey. We kept it kind of short to keep people convenient as well, but we'd obviously want more data and backing up of that to kind of know all that stuff too. Like I said, with the males, we want to get more of the males and also females over in general, just to get more information. The more information we have, the better idea we have. So just a broad picture. But again, this is a great start for everything. So we kind of know a general where the stress is lying in the organization. There's many different stress assessment tools that you can use, so they can kind of further on go with that if that's something that was interesting. But that's all I have. Does anybody have any questions? I'm just going to flip to my references page here. No? All right, sounds good. Well, thank you again for letting me present and let me complete my project here. I really appreciate all your help.
You're welcome.
Thank